Welcome back. We are still in duty station 1 and we are on task 1.4. Okay, and this is identifying classes of medications. As a medication aid, you are not expected to know every side effect, every adverse reaction, every diagnosis that goes along with your medication. However, you should have a basic understanding. And if you're not sure, Google it, okay? You have several different types of medication classes: antibiotics, cardiovascular drugs, drugs that affect the nervous system, respiratory tract drugs, gastrointestinal drugs, hormones, cancer drugs, ears, nose, and throat drugs, topical medications, and nutritional agents. Okay. You have three different types. You have controlled, which is your high incidence for abuse. They require special storage, designated as a controlled, and by action or by body system, it is identified. Okay. You have non-controlled, meaning those are the medications that the doctors order and they do not require special handling of any kind. And then you have over-the-counter. They do not require a doctor's order. Okay. The purpose and the effects of drugs. Effects, you have desired effects, undesired effects, and then sometimes they're no effect. Then you have polypharmacy, where that's multiple medications. One drug can increase the effects of another. One drug can decrease the effects of another. And drugs combined can form a new drug of an unknown effect. Okay? Psychotropic medications. You have your anti-anxiety, your antipsychotic, your hypnotics, which help you go to sleep, your antidepressants, and your neuroleptics, which are for seizures. Okay? You have different type of medications that sometimes can cause what's called a chemical restraint, and that is a drug prescribed or administered with the intent of controlling the mood, mental status, or behavior that is used for convenience, okay, and not required to treat the client or the residential's medical symptoms. A chemical restraint is if you've given an excessive dose over an excessive duration without adequate monitoring, without adequate indication, and it has caused a decline in the client or the resident's function. Okay. A few examples: antibiotic, you have amoxicillin, Augmentin, Bactrim, things of that nature, penicillin. A cardiovascular drug, which is to help the heart. You have Lanoxin and Vasotec. Drugs that affect the nervous system, you have an example of Prozac and Xanax. Respiratory tract drugs, you have Asmacort, you have Albuterol, you have Ventolin, Atrovent. Gastrointestinal tract drugs, you have Prevacid, you have Pepcid, hormone medication, you have Promarian, which is an estrogen, and you have Prempro. Cancer drugs, methotrexate and tamoxifen, and you must wear gloves at all times with those, and then wash immediately afterwards. You have ears, nose, and throat drugs, which could be Serumnex, which is an ear drop, and pillocarbamine, which is an eye drop. And then you have topical medications, which are creams, ointments, and lotions. And that concludes this duty area.